Hello, everybody. I am so excited to welcome this week's guest, Dr. Jennie Byrne. I'm going to have her introduce herself for those of you who are watching the video. Hi, Jennie.
Hey there. So I'm super excited to be here with you as well. For those who may be listening, my name is Dr. Jennie Byrne. I am a psychiatrist and a neuroscientist by training, and I actually did my PhD in attention. So I've been passionate about this topic for many, many years, and I live in Chapel Hill, North Carolina. And I got two teenagers and a spouse who's changing careers into writing.
Wow. Wow. That's wonderful. Well, so I just want to kind of get right into it because your area of expertise, as I've gotten to know you over the years, I'm so excited to just have you here today. So thank you so much for your time. So for those of you who've been following the show for a while, you know that I'm a behavioral pediatrician, and this coming month, October, is ADHD Awareness Month. And as part of this, we're interviewing women with ADHD. And I know that some of you have been thinking about this, especially as your children come in to see me, and then you learn about ADHD, and you're like, I wonder if I might have ADHD. So part of the awareness that we've wanted to showcase this month has been sharing women's stories about those who've either had ADHD as a child or late diagnosis. And I thought Dr. Byrne would be a perfect guest to kind of help segue and bring it all together because I want to talk with her about sort of ADHD workup in women, especially when it comes to later in life. I know there's a lot of questions about perimenopause, menopause, how does that all fit in? So maybe we should just start off with, what should someone do if they're concerned after learning about ADHD for their child and wondering, do I have ADHD?
I'm so glad that you're asking me this, Nerissa. And I'm going to call you Nerissa. You call me Jenny because we
Yeah.
know each other. Um, so it's really common. I see this a lot. So I'm an adult psychiatrist, so I don't see kids. Typically, I see adults. It's really common for someone to have a path that lands at my door where they have a kid who was diagnosed with ADHD, just like you said, and then they're like, "Oh gosh, wait a minute. This sounds like me." And then there are a lot of open question marks, and those question marks can be unsettling, I think, for a lot of women and men too. As you know, ADHD is highly heritable.
Mhm.
So if a kid has ADHD, good chance one of the parents has ADHD as well. So it's worth getting the assessment. And I would say my first message is no matter how old you are or what stage of life you're in, it's worth getting an assessment if it seems genetic in your family or you really read about it and think it sounds like you. There's some docs I've heard out there who say, well, if you're not in college, it doesn't matter anymore. And that's, as you know, totally not true. So if you're 20, 30, 40, 50, even I've seen even 60, 70-year olds getting diagnosed with ADHD, it's still important, I believe, to have the assessment, even if you decide you don't want any further treatment of medicine or non-medicine. I do think that the assessment provides clarity and
Yes.
helps you understand about your brain and how your brain works, and maybe you can optimize your life to fit your brain as best you can. So my first message is it happens a lot, and sometimes I see women who were diagnosed as kids, which is kind of unusual because back then it was mostly thought it was boys. But let's say you were diagnosed as a young girl or a young woman, and maybe you had some treatment and it didn't go very well. I see a
Mm.
lot of women who say, well, I did have treatment, but I hated it. It was awful. I don't really want that again. So why bother, getting assessed as an adult? So if you're listening and that's your scenario, you should know that there are a lot more options than there were back when you were a little kid,
Mhm.
including things that are not Adderall or Ritalin. Maybe you had Ritalin as a kid and you didn't like it. Also, you're a different person. Your body is different now than it was back then. So the assessment helps you decide what is right for your body and your brain in this moment in time. And that may change over your lifespan. There may be times when you don't want treatment or need it, and then there may be other times when you do. So that's kind of the first thing. And then the second thing, if you weren't diagnosed as a kid, but you have a kid now and you're like, wow, that looks like me or sounds like me, it's really, I believe, again, important to have an assessment that thinks about you as a whole person, because as an adult, our bodies are different than as kids. If you're perimenopause, in the middle of menopause, post-menopause, or even if you just have some chronic medical issues like hypertension, diabetes, obesity, a lot of us have these kinds of issues, and that impacts your brain. So a full workup really thinks about you as a whole person. So it encourages you to seek out assessments that are not just ADHD only, somebody that really is thinking about you in the big picture, including your body, which may be going through hormonal changes or medical changes or other, commonly co-occurring things like depression, anxiety, all these other things. It's really important to have somebody who can see the big picture.
Yeah, I'm so glad that you mentioned that. I mean, I think even just the other day, I was talking to a father actually who said, his hesitation about coming to see me was that his experience as a child on Ritalin was terrible. And so he was really afraid that if his child was found to have ADHD, he was like, I don't even know if I want to go there. So let's not even open up that can of worms. But I'm so glad that you said that. And many parents who are of a certain age when they were children, that was all that there was. We've learned so much about ADHD, and there's so many other treatments available.
And we're learning more every day. So the research has picked up and the tech is picking up. And so even if you're somebody that's like, I don't want to take medicine, I hate medicine, there are a lot of people who feel that way. And I totally understand that. There may be things out there that aren't even medicine, that are coming. And so for you to know how your brain works, you may be able to find things you can do to help that aren't even taking a medicine, regardless of what type of medicine.
Yeah. Yeah. So, this is going to be a wonderful discussion. I think maybe where we should start then is like, what is a workup for an adult that takes a holistic approach? What can that person expect, or how can they best prepare for that?
So, an assessment, I think people sometimes get hung up on like who does the assessment. Is it a doctor? Is it a nurse practitioner? Is it a PA? Is it a psychologist? I don't really think it matters so much what the license is. It's really more the process. So, when you're an adult and you're getting worked up for ADHD, even if you had it as a kid and you had the diagnosis, I do recommend getting an updated assessment. For me, what I look at are a couple things. Um, First of all, I want to hear your history. So I want to hear your story. Things that may not have felt like ADHD as a kid may have actually been ADHD and you just weren't aware of it. I also want to hear about everything that you put in your body, including food, coffee, marijuana. There's a lot of CBD, THC out there right now. I want to hear about other substances you're putting in your body. Are you smoking? Are you vaping? Like, what are all the things that go into your body? I want to hear about what are your medical issues? Like, how is your physical health? Are you having hormone changes? Have you been to your primary care? Have you had basic lab work done? Do you have thyroid issues? And then I want to hear about your family history. So that's medical and mental health. I want to hear who else had ADHD because, as you know, it's very heritable and it may not have been called ADHD when great grandpa had it, but great grandpa may have a life story that's kind of consistent with ADHD. So there's kind of like all those questions about you as a person. I find it extremely important to know what is your life right now. So if you are in school, what kind of school are you in? What are the demands of school? If you're working, what kind of job do you have? What kind of tasks do you have to do at your job? How do you feel about work? What are your coworkers and your boss saying about your work? If you're at home, How are you functioning at home? How are you doing with the different tasks that running a household requires? If you're with a partner, spouse, what do they say about how you're doing? If you have kids, how's that going? And also, not to be forgotten, social, your community and your social. Do you have friends? What is it like? What kind of activities do you like? So you can hear this is like a lot of questions. So
Mm.
this is not a 10-minute primary care visit. Most primary care doctors, if they're comfortable doing ADHD assessments, just simply will not have the ability to spend the time with you in their practice setting. Um, some of the other things then that I think about are medical. So let's say we did all of the questions and I said, yes, this really sounds like it could be ADHD. The next kind of what I would call objective data, so not your self-report, but numbers that we can look at together. I do like to do a computer test of attention. There are different ones out there. The one I use, which I think is the one Nerissa uses, is about 20 minutes on the computer, and you can do it at home or in the office. It's really super boring, and that's how it's supposed to be. But I also look at objective data from questionnaires. There are different ones out there. I like for adults one called the Barkley. And the way I do that is you would complete a bunch of questions. It's probably like 100 questions. So it's kind of long. And then somebody, a significant other or family friend would do another one. And then we would compare and score it. And then finally, I like to look at the medical objective data. So again, what was your thyroid level? What are your electrolytes? What's your lipid panel? I want to see all those kind of basic labs to make sure that we may not be missing something medical. So once we've kind of gathered all that together, it does take some time, by the way. It does take some time and effort on your part. So you have to know that kind of going in if you really want to get a good assessment. But you can get through it all in less than a week if you really are super efficient and the person is doing your assessment is super efficient. You can get it done in a week. So then we kind of put all that together and then we say, okay, is this ADHD? And is it something else? And is it something in addition to ADHD? If you've been undiagnosed until adulthood, unfortunately, odds are pretty darn good that you have some depression, anxiety, or substance use along the way. And that's probably because you were self-medicating and trying to take care of some ADHD symptoms that were confusing to you and kind of getting in the way of you succeeding. So that's how I do my workups. I think I'm very thorough, and that's intentional because I really believe it's important because I have seen people come to me who think they have ADHD and they don't. So
Mhm.
sometimes they'll have a thyroid problem. I've seen that before. I've seen women who are in the middle of hormone shifts with low estrogen states, and their cognition is suffering because of that. I've seen people who are using a lot of a substance, whether that's illegal or illegal substance, and that's affecting their cognition. I can kind of go down the list, but there are a lot of things which look like ADHD and are not. And if
Mm.
you treat them incorrectly, sometimes you can do more harm than good. And then I'll just add one more thing, which is I often see, especially in women of this age, that they've been treated for years for depression and anxiety. And once we get the ADHD diagnosis, we say, wow, actually, that's it. And we can take them off their medicines for depression, anxiety, and they can refocus their therapy from just support and coping into like actually learning how to make the most of their ADHD brain. So that's a lot of information. I'll pause, but that's kind of how I think about it.
Yeah, no, that's great. And I'm so glad you sort of mentioned that because that scenario is so common amongst my colleagues, my friends who are the same age as I am, and where they are treated initially for anxiety, depression, but then find out, lo and behold, it's actually ADHD. And they wonder about that, like, oh my gosh, it's been missed, or has this been something that was treated incorrectly, but once they get on the appropriate regimen at that, point in their life, they just thrive. They do much better.
Yeah, I've seen that play over and over and over. And some of the interesting things about treating ADHD, if you do choose to take medicine, some of the medicines are like kill two birds with one stone. So atomoxetine, for example, is a non-stimulant, not Adderall or Ritalin, and it is really good at anxiety. So if you do have anxiety and ADHD, actually that kind of is a kill two birds with one stone. Or if you're significantly depressed and you have ADHD, bupropion, again, a non-stimulant, might be really helpful. So that's kind of a interesting thing about the medications we have currently. And then also I see a lot of women who have been frustrated in therapy. They feel like they're not making progress anymore. And part of the reason is that the therapist is being as helpful as they can, but they don't know the person has ADHD. And so some of the strategies they're suggesting are actually counterproductive. So, for example, women with ADHD may need more visual reminders as opposed to text reminders or other kinds of reminders. And in an effort to declutter their house and clean up, they remove all the visual reminders. And actually, it may be more helpful for them to have visual things in their workspace to help them. So sometimes people are trying to be helpful, but it's counterproductive if you don't know how your brain is optimal.
Mhm. Yeah, and that's why it's so important to take that more comprehensive, holistic approach because, as you said, there are things that can mimic ADHD or coexist with ADHD. So we want to just make sure ultimately what we're treating so we can craft a plan appropriate to that. So,
Yeah, and it's not all medicine. Again, I say that over and over because I know a lot of people listening are probably thinking, oh, I don't want medicine or I'm scared of medicine. Medicine
mhm,
is just a tool in the toolbox.
yes,
And it does, and also once you take it, it doesn't mean you're taking it forever. I've had a lot of adults where when life is good, things are low stress, job is really good, they can go off medicine or be on a low dose. But wow, I have a new baby at the house and I have a new job and my spouse is having an issue and life is just layering a lot. And then my brain really benefits from that extra help. So even if you choose to try medicine, it's not like you have to take it your whole life. There are conditions like bipolar disorder where most people do probably need some medicine lifelong, but ADHD is much more fluid. I find much more fluid than that. And I just think about our brain as like having extra reserves. And when life throws a lot at you and those reserves are depleted, you might need some help. But then there are
yeah.
other times, life might be good and your reserves might be high and your brain doesn't need that extra help.
I'm so glad that you said that because I think sometimes women, especially because and again, this is a big generalization. So for my male listeners, please don't take any point with this. But, sometimes women do carry a lot of the mental load of running a household. And I think what you just said there is so important because there are going to be times where it is just a lot. And then they feel like, well, why can't I just figure this out?
And the reality is, I want to validate for women who may be listening. If you've gotten this far, you've done a good job because you've gotten this far without even knowing you have ADHD. So I do want to validate for people. It may have been a big struggle for you, but if you've made it this far without something seriously bad happening, kudos to you. You've obviously come up with your own ways, whatever they are, to cope. But yeah, Nerissa, you're right. I think there are a lot of gender roles around households in particular,
Mm.
where women in a household will typically take on the brunt of household organization and family calendars, of which I am in charge of that. And I can tell you, I know how hard that one is. And so, whether you have ADHD or not, those gender roles can be, I don't know, it's like women just forget that that's an assumption. Like, it's an assumption that you make dinner, but why? Like, where did that assumption come from? Nobody says you have to, there's no law saying you're a woman, you need to make dinner every night. I personally do not make dinner ever. But I do the family calendar because I'm good at that. So, a household is all about looking at the resources you have and the goals of the household, and then divvying it up amongst the people in the household and maybe getting extra help where you can and you can afford it, and deciding like what's the priority. So I know a lot of women come to me and I'll challenge them, and they'll say, well, I have to do this and this and this. And I'll be like, says who? Who says you have to do the laundry? I don't know. Your kids are 10. Who says your kids can't do the laundry? I don't know. Or I have to get dinner on the table. Says who? Is it your spouse saying that? That's a conversation.
Mm-hmm.
Who says that you have to, like, the roles are just assumptions. And so I've had a couple patients where and some of them weren't for ADHD, where we just made literally like a list of every single thing that has to happen in the house. And then we just said, who's going to do what? And you sit down with your significant other and maybe your kids, if they're old enough, and you literally just divvy it up. And there doesn't have to be any rhyme or reason to who does what. Maybe somebody likes laundry, somebody likes cooking. So I've done that exercise before, and that list is a pretty long list to run a household, especially with the spouse and kids, little kids especially. Like, it is a long list.
Yes, it is. It is. So, so Jenny, can we go back to something that you had mentioned? I mean, you mentioned that in the process of doing a workup for ADHD, you're looking at other things that uh, can happen, including hormonal shifts. I think some of the things, and myself included, going through menopause, low estrogen levels. Can we talk a little bit more about that and what we know about the role of hormones and ADHD presentations?
Yeah, I would say, first of all, it's an emerging science. So we don't know a lot, to be honest with you. I think we're learning quickly, and women's health is finally catching up. So in the next couple years here, you're probably going to hear a lot more detailed information than what we know today.
Hmm.
But basically, estrogen is a hormone, and estrogen helps different kinds of cognition. So estrogen is really helpful for attention. Um, and when you're in a low estrogen state as a woman, whether that's because of a menstrual cycle or a perimenopausal state, low estrogen means your brain does not have that hormone to support attention and focus. So that brain fog, or that, sometimes I call it mom brain. That's just me personally. Sometimes I have mom brain issues. Full disclosure, I've been in the perimenopause myself for a number of years. I do not have ADHD, by the way, but yet that brain fog or that hormonal shift can really do a number on what was your baseline. Also, we all age, so normal aging decreases our cognitive capacity. So
Hmm.
depending on when you've had children as a mom or a woman in perimenopause, if you're older, i.e. over 35, your cognition has started to naturally decline. So in addition to the hormonal shift, you have a natural decline. Unfortunately, a lot of women and men, especially during the pandemic, really picked up their alcohol consumption.
Mm.
And a lot of people have picked up THC and CBD, partially because it's become legal many places and just socially more acceptable. And I want to say, I'm not pro or con any substance that you put in your body. I'm all about, like, how does that substance impact you? And is it something that helps or hurts?
Right.
So when I'm generalizing, but a lot of people are drinking more alcohol and they are using more THC and CBD. And both of those compounds affect cognition too. So there's a lot of things that could be going on as you're aging into your 30s, 40s, or like me in your 50s, where your brain is already under some duress. And then if you throw in some other health conditions like autoimmune issues or even untreated hypertension,
Mm.
puts a strain on your brain. So I think the hormones, it's like, I think it's important, but I also want to make sure people see it in the big picture. It's the estrogen and the hormones, but it's also all the other shifts in your body that may be happening as you get older. Now, the
Mhm.
good news is our bodies are very adaptable. So if you're 35, 45, 55, 65, your body can still adapt. So you can still make changes to your health that will improve your cognition. including taking medication. But like for me personally, I cannot take estrogens because of my health history. And so I've just had to find other ways to work with my cognition.
Mhm. Maybe we'll go there, 'cause I like the flow of this. And I think, so thank you for one, clarifying kind of the complexities of both mental and physical health, especially through the lifespan and how it affects cognition. But I've heard you say, medicine is just one tool in the toolbox. What are some of the other things that individuals can focus on, especially if one, they don't want to do medication, or two, they maybe want to, but only sometimes. But what else can we be doing to optimize how our brain is working?
Oh, I love this question because I love when people ask me this question. You're a psychiatrist, and so a lot of people just want to ask you about medicine, but that's, I'm a physician first. I think about your whole body. So I love when you ask me that question. Um, so the first thing we can do, it's actually free and it's been around since humans have been around, and that's sleep.
Oh,
So getting actual sleep,
yes.
giving your body the opportunity to get the sleep it needs is cheap and we can all do it. However, in almost everyone I work with, it's one of the first things that I see be really out of whack. And
And
there's
it's
a
hard,
lot of reasons.
elusive. It's hard and elusive for some of us, more than others.
Most people, and I can say again, my lived personal experience is that when I was younger, I just hit the pillow and I was zonked out and it was great. And that's not the case when you're older and you have to get up to go to the bathroom and then you're having hot flashes in the middle of the night and you got babies waking up and crying and you got spouses snoring because they're not, there's so many reasons just before we talk about electronics and blue light. And then the other thing, if you do have ADHD, it's very common that your circadian rhythm is shifted.
Hmm.
So normally you'll see ADHD is kind of that night owl profile, and not everybody, but many. And it's about 3 hours phase shifted. So your natural bedtime is more like 12 midnight or 1. But unfortunately, your workday starts at 8 or 9. So it
Yes.
doesn't match your circadian rhythm. So I think sleep, if I had to say one, like if you're listening and you're like, I don't want to get assessed, I don't want to take medicine, I just want to like get better, the first thing that you can tackle is sleep. And to make sleep happen requires a lot of, I have felt it requires a lot of discipline because the world around you is not geared for you to sleep the way you want to sleep. I don't know what your experiences have been, Nerissa, with your patients or with yourself, but for me, it was really, really tough. And I have to have a lot of discipline to get that sleep.
Yes, I mean, for me, full disclosure, sleep is elusive for me. Like I will do really good for a little bit and then fall off the bandwagon. I am a night owl and I am notorious for sending emails at 1 in the morning because I just can't sleep. So I know how important it is, but it is so hard for me to stay disciplined and consistent. So that's why I'm so glad we're talking about it because it is so important. It is so key.
And one of the things that's most exciting to me, and I actually wrote a book on this in 2023, which is like the one right behind me there. Um, as the pandemic hit and people started to break free of traditional 9 to 5 schedules at work, if you have ADHD as an adult and your career, your job, whatever allows you to be flexible, you can really figure out like, wow, okay, my ADHD brain wants to start work at noon and my ADHD brain works great at 10 p.m. So what kind of job can I do with the flexibility, or how can I shift around my meetings, or how can I talk to my boss and my coworkers to say, hey, my brain isn't working very well at 9 a.m., but it's working great at 4 p.m. Can we schedule this meeting at 4 p.m. instead of at 9 a.m.? And that can actually make a big difference. Similarly, with some of the AI tools coming out, they really can help with blocking notifications and distractions or taking notes automatically for you. A lot of these kind of like detail-oriented, boring administrative tasks that ADHD brains typically don't like, there's
Mhm.
actually a lot of ways pretty cheap and easily that you can work around that. So when thinking about sleep and when your brain is at your best, with the new ways of working, a lot of people are able to get that flexibility and just ask for it.
Mhm.
And so it's actually a lot easier now for many people to have their ADHD brain working at its best on or off medications on their own schedule. But it does take some creativity and sometimes some uncomfortable conversations with your boss and your coworkers.
Mhm. Yeah, so sleep and learning about how your brain works and working with it rather than against it. I guess, do you have any quick suggestions for being disciplined though to get that sleep that your brain needs?
Yeah, so some of the tips I found with my ADHD patients and adults that are most helpful is really spend some time with the notification system on your phone in your computer.
Mm.
So using filters to filter out distractions, it's worth taking a couple hours even to sit down and really like optimize your phone and your computer so that anything an ADHD brain visual stimuli are is very highly salient, meaning like you're going to pay attention to it. And
Yep.
every single time you divert your attention to one stimuli, like a notification popping up on your computer, it's going to take you a lot longer to go back to what you were doing. So every little notification matters. So you really want to try to like minimize all those notifications. Another tip that I recommend, and this is for everybody, not just ADHD adults, but I personally find email and Slack to be extremely distracting. And I don't have ADHD. I can't even have my email open and see the number of messages popping up. Like I will get distracted. So the concept of chunking similar tasks is really helpful. Again, this takes a lot of discipline because it's not the way a lot of people are used to working. So basically, choosing one or two times during the day, or maybe three or four if you have to look at email
Mm.
and then closing that out. So for me personally, what that looks like, I get up in the morning. Honestly, to be honest, Nerissa, before I even get dressed, I mean, I'm sitting out like in my pajamas and I do all my email and then I close it and I don't open it again. I'm pretty disciplined. Most days I don't open it again until 3 or 4 p.m.
Wow.
And again, everyone's different. I'm not saying that's right for everybody, but if you can pick one time to go through email and then close it out, same
Mhm.
for Slack or DM or Office or whatever you're on, and like close it. Close the window, turn off the notifications. Again, you have to communicate with others that you're going to do this so they know when they can get you. So, my suggestion that I use is if it's urgent, if I have a team member and they really need to get me, I give them my cell phone
Mhm.
and they can text and I will see that. Or they can
Yeah.
call me. If it's really urgent, like within the next 3 hours, I need you, Jennie, like they can text me.
Mhm.
Um, so so chunking similar tasks and then closing them and turning off all the notifications is really helpful. Another thing for sleep, I've been kind of deep in the weeds on this because I was struggling with my own sleep so much. But waking up at the same time every morning turns out to be way more important than when you go to bed at night. So having the discipline on the weekends, this is what I find hard. Don't sleep in on the weekends. And that's
Mm.
so counterintuitive because you're like, that's the time I have to sleep. I don't want to wake up at 7 a.m. Well, if you got to wake up 7 a.m. every other morning and you wake up at 10 a.m. or 12 on the weekend, your body is confused. So having the discipline to do that. And then the time before you go to sleep, it's really about the wind down. So giving your body the space to wind down and be ready for bed. So this is like common sense, right? Like don't eat your meals late, don't go work out late, don't look at blue light on your screens late. And that's we all kind of know this, but it's the devil's in the details.
Yeah.
And finding ways to make it fun to not be looking at your screen before bed finding other things that are fun to you, finding other things that feel calming to you may not feel calming to me. That's the other thing I've learned is just because it's calming for someone to read, one person to read a book doesn't mean it's going to be calming for everybody. So I love using bio trackers. So right now I'm using a ring, but
Mhm.
there are different kinds out there. And I love being able to say, okay, here's what I did today. What does this tell me about my stress level? And as it turns out, reading a book is not super calm for me. I actually get really engaged in books. But if I do something with my hands, that really does seem to calm my body down. So I actually find that doing things with my hands, like crafts or other things, really calms me down. So
Hmm.
that's my body. Your body is going to be different. Everybody's body is different. So it's really like, how can you use a tracker or just writing things down? Like, how can you learn more about your own body and your own brain? I think that's really like the bottom line.
Yeah, no, I love that. And you mentioned some trackers. So yeah, I've seen some of those devices. So you're a proponent for that so that you can kind of learn what those rhythms are, what your body needs and what it and when it's thriving, when it's, all of those that extra data is just so helpful and gives us insight rather than feeling like, well, I think it's this and I'm not sure if it's that, because life, as you said, is not controlled and there's so many different variables there, but it's really helpful information. Um,
Yeah,
these
I would
wearables.
say the only exception to that is I work with some folks who do tend towards the OCD, obsessive compulsive spectrum. And in
Yes.
that case, it may not be the best for you. If you tend to be obsessive compulsive, like having data actually might not be your friend. So it's not 100% true, but
Mhm.
majority.
Yeah, yeah. Well, I think, the tips that you provided to optimize, other than medications are really practical, really helpful. So thank you for kind of spending some time on that because I think again, people who are listening to this may be like, "Oh, I can start doing at least one of those things today." Right? And that's what we want them to do. Because if they're concerned and they can hear something that, yes, I can actually do that. Like, yeah, do it. So, yeah, I'm hoping that after people listen to this conversation that they get really excited about that. And I guess lastly, because I don't want to, I wanted to just honor your time here, but I'd love if you could speak to just some of the work that you do. So that way, if people want to continue learning more about and tapping into your expertise, figuring out if they can work with you, can you just mention a little bit more about your day to day and how they can get a hold of you?
Yeah, so my day to day is actually probably similar to the day to day of a lot of ADHD people who like novelty. I like novelty and doing different things. So I do spend a lot of my time advising people in the healthcare system about how to make things better, especially in mental health. So I
Mhm.
spend a lot of time there, but I really do enjoy working one on one as well. I've been practicing clinically for decades, and I do have a virtual practice that I'm welcoming new patients. And it's a little bit of an innovative model. It's much more fluid. It doesn't have strict appointment times. It has texting, has some of the computer testing I mentioned to you. So it's kind of a new way of working with a clinician, but it's a really good fit for people who are professionals, for other clinicians. That's a big issue. I know a lot of clinicians, if anyone's listening, you're probably really scared about talking about mental health because you're worried about your job. So I'm here for you if that's you, if you're a professional, or if you're just somebody who has kind of an erratic schedule and you don't really want to be tied down to like set appointment times. I may be a good fit for you. I'm licensed in about, I think 12 states right now to do actual treatment. But I can coach and advise in all the states, but in terms of like being your physician, that's only in the states where I have a license. And
Mhm.
that practice name is called Constellation PLLC. And the best way actually is just to send me a text message. So you don't even have to like go to my website. If you're listening, I'll give you the number. You can just text me. It is 919
Mhm.
I'll say it again, 919-887-8517. And you can just send me a text. right now if you want, and I'll be sure to get back to you. If I can't help you, I'll be sure to help you find someone else who might be a good fit for you.
Wow, that's so generous. Thank you. And we'll make sure to put that in our show notes as well. And then I was hoping you could kind of just give a little about your books that you've authored,
Oh, sure.
because that's also something
So
else that you do.
yeah, we didn't talk about that today, but part of what I like to do is I'm a researcher at heart, and when I want to fix a problem, I just dig in and start researching as a brain and behavior specialist. So I wrote a book. The blue one here behind me is called Work Smart. That's from 2023. If you are looking for a lot of tips about how to optimize, some of the things we mentioned, like chunking emails, I have a lot of tips about Zoom meetings, ways to structure your time. That's a really good book for you. And then if you are a clinician or you're somebody who's thinking about healthcare, the second book just came out this summer. That's called Moral Injury, Healing the Healers. And that will teach you about what's happening in healthcare today. And if you're a clinician, I hope it will support you and speak to some of the stuff you may be feeling. And also, I'm really just trying to make things better and have an impact. So if you like to read, those are good choices. They're on Amazon. Just look them up on Amazon with my name, Jennie Byrne. And they do have audiobooks if you prefer to listen.
Oh, that's so great. I'm so glad you said you have audiobooks because I know many people with ADHD, they like the idea of reading, but sometimes it's just hard to sort of fit that in. So many of my parents have asked, do they have an audio version of that? So I'm so glad you do.
Yeah, and if you
uh,
listen to the audiobook, the first one is my voice. I did it myself and it took a very long time. And then I tried something new. I tried the AI version for the second
oh,
book, so you can compare and contrast and tell me what you think. I think the AI did pretty darn good for something that took me maybe 20 minutes as opposed to like 100 hours.
wow. That's incredible. Well, congratulations to you, Jenny. I know we haven't known each other that long, but the more that I get to know you and have these conversations, I am just so thrilled and pleased to have you in my orbit. So thank you so much for the work that you do, for helping educate our listeners today, and hopefully some of them will find their way to you, because again, why not seek out help from someone who takes that very comprehensive, holistic approach, and just, can speak to both medical and non medical options of treatment? So, thank you so much. I really appreciate your time today.
Thank you for all you do, Nerissa. I'm so happy you're doing a podcast and spreading your work further. It's been a pleasure to get to know you. And thank you for having me. And thank you to everybody listening.
Thank you.